In this video, we will continue to learn about the invasive diagnostic procedures and nursing actions you must know for exams. Let's start with ABGs, which are arterial blood gas. ABGs are established with arterial puncture or arterial line. This test allows the most accurate method of assessing respiratory function. Important nursing considerations include the following. The sample is drawn into a heparinized syringe. Keep sample on ice and transport to the laboratory immediately. Document amount and time for accurate results. Apply direct pressure to puncture site at least 5 minutes. If the client is at risk for bleeding, hold pressure for more than 5 minutes. Monitor for bruising and hematoma. Perform Allen test if no arterial line cannot be established. Next is a bronchoscopy. This test is used to visualize larynx, trachea, bronchi, obtain tissue biopsy, foreign body removal. Important nursing considerations include the following. Obtain informed consent for starting the procedure. Maintain NPO status 8 to 12 hours before the procedure. Provide local throat spray for patient comfort. Position the patient upright. Administer medications as prescribed, such as atropine, to reduce oral secretions. Other medications may include sedation and/or anti-anxiety medications. Label all specimens. Observe post-procedure for the following: gag reflex, bleeding, respiratory status, vital signs, and level of consciousness. In the next video, we will continue with the Mantoux test.